So I've already compared my doctor's orders to my MAR, and now I'm going to complete my first check by comparing my MAR to my vial. So I see that I have Emma Wrightson, the right patient, and they have no known allergies. I have Cloxacillin, the right medication. I need 1 gram, and I am able to retrieve 1 gram from this 2 gram vial. It is administered IV via CIVA pump, which is an appropriate route for this med, and it's given Q6H the next time being now. So I've completed my first check. I can also see that this vial has good integrity and it is not expired. So I'm now going to refer over to my drug monograph about this medication. So Cloxacillin is an antibiotic, and it is appropriate for me to be giving this to my patient because we suspect an infection via scratch on her left arm. It is appropriate to be administered by a student nurse, and the 1 gram Q6H prescription does not exceed the maximum daily dose of 12 grams or single dose of 2 grams. Now, to reconst a 2 gram vial, which is what I have, I need to add 6.8 milliliters of sterile water for a final concentration of 250 milligrams per milliliter. So, before getting started, I am going to clean my hands and gather the appropriate equipment. I can see that the sterile water I'm using is not expired and has good integrity. I'm also going to use a 10 ml syringe, 1 fill needle, and an alcohol swab to get started. So, I would swab the tops of my vial for 30 seconds, let dry for 15, being sure to remain sterile with this. And we're going to say it's been 30 seconds plus 15. I would normally get a new blood fill needle. I'm going to prepare my needle, my syringe. So like I said, I need the 6.8.
I'm going to do my second check. So again, the right distributions is Fiona Friedman.
Making sure I have 6.8 of air and putting it into my sterile water.
And the right dose is 40 milligrams. The right volume is 10 doses in the syringe here. The right route is IV. The right time and frequency is daily. And for allergies, it's morphine again. So I'm just going to change the blood fill.
Make sure again I have that 6.8.
So I'm going to start by just cleaning.
Okay, and now I'm just going to get rid of any extra bubbles.
Water, 30 seconds.
Alright, and I have no bubbles, and I have 6.8. Perfect. Can now inject this into my medication. And I can recap this using the safe method, scoop method, put it off to the side. Now I'm going to roll the medication in my hands to make sure all of the medication is dissolved. Now, referring back to my dose, I need to give 1,000 milligrams. Since the final concentration is 250 milligrams per 1 ml, I will be withdrawing 4 ml. So, I'm now going to swab the top of my vial again for 30 seconds, let dry for 15, since I did roll it in my hands. And again, taking out the 4 ml.
Do you have any allergies? No. She has a morphine allergy. Yeah. So also
making sure to eliminate any bubbles.
So I see no redness on the item side and there's no signs of infiltration. I'm also going to do
and I now have the 4 ml. I am going to recap this, maintaining sterility. Okay, so I've already had the chance to fill out a label. So I put my patient's name, the appropriate medication, which is Cloxacillin. I know that 1,000 milligrams is equal to 4 ml. And now I am going to administer this via CIVA pump, so I will refer over to the CIVA guide here. So for Cloxacillin, when you have a 1 gram dose, you need to use a 60 ml syringe for a total volume of 50 ml in it. Since I already have 4 ml of medication, I need to use 46 ml of normal saline, set the pump on a normal rate, and infuse over 39 minutes, which I have included on my drug label. So I'm now going to complete my second check. I know that my patient's name is Emma Wrightson, the right patient. I need Cloxacillin, and Cloxacillin is what I have. I need 1 gram, and I calculated that 1 gram using this vial is equal to 4 mLs, and I have 4 mLs. I am administering via IV CIVA pump, which is appropriate for this medication, and it is given Q6H, the next dose being now. So I can now dilute my medication, again referring back to my CIVA photograph. So I have the appropriate equipment I need for this. I am going to again use normal saline. I chose this because it is compatible with my patient's primary line, and it is easier to retrieve from a bag for such a large volume. So I will retrieve that 46 mLs, and I'm going to start off by swabbing. I do so for 30 seconds, let dry for 15, being sure not to touch it, and I'm now going to prepare my syringe. Peeling back, maintaining sterility, and I would maintain sterility, and I'm going to get 46. And I can see that this syringe works. Perfect. I'm going to picture this. Being sure to and right here I have 46. Making sure I have 46. There we go. Getting rid of the bubbles.
No bubbles in here. It's got 1.6.
I'll pull out a few extra. I'll recap it. Making sure not to touch the tape. Pull back. Get rid of all these extra bubbles. Back up. I'm just going to discard of any extra.
3 seconds. Another syringe here. In the top.
Perfect, so I now have 46. And now recap this. Maintaining sterility. And pull back so I can inject my medication into it.
Again, feel me, let me know if you need any help.
Injecting my medication. And normally I would dispose of this in the sharps container, but for now I'm just going to put it off to the side. Perfect. I'm now just going to ensure I have the correct volume. Perfect. And I can attach a blue cap. Okay. Now I'm going to attach my med label and gather the appropriate equipment to bring to my patient's bedside. So I have my tubing, alcohol swab, my medication. I also bring in my MAR with me. There we go. Okay, and a pen. Okay, so as I'm walking into my patient's room, I am doing a safety check. I can see that my patient is not in distress. Side rails are up, beds in the lowest position, call bells in. Hello, my name is Mikaela, and I will be your student nurse today. I'm also performing a safety check by looking at their current IV. I see that the appropriate solution is running and at the right rate. There's no kinks in the tubing or clamps on. In the IV site, there's no signs of infiltration or inflammation, and my patient has no complaints of pain. So could you tell me your name and your birthday? And do you have any allergies? No? And I'm going to also compare it to the wristband. So I see here that I have the appropriate patient, Emma Wrightson, with no known allergies and the matching FIN number as well. So, complete my first check. So I have Emma Wrightson, Cloxacillin. I need 1 gram. I know that 1 gram is equivalent to 4 mLs, and I have diluted it with 46 mLs, so I have a final volume of 50 mLs, which is correct. It's administered IV CIVA, which is the right route for this medication. And as I have indicated, It's given Q6H, the next dose being now, which is appropriate. So I've done my third check, put this aside. So Emma, today I'm giving you a medication named Cloxacillin, and it's to help with your current wound that seems to be infected. Some signs you may experience are diarrhea, nausea, and vomiting. Do you have any questions regarding the medication? No? And is it okay for me to give this to you? Yes? Perfect. Okay, so my patient has agreed to take the medication. I have also reviewed any correlating lab values and vital signs to monitor, such as her temperature, since it is believed to be an infection. So I am now going to prime the tubing, which I have right here, making sure there's no kinks and that the lock is not on. So I can uncap this and uncap this and attach it. The remaining sterile. Also going to remove this cap and assess for bleb, making sure not to touch the top of it.
Now, check here. So we have
and I see a bleb. I'm now going to recap it. Okay. I'm also going to attach the label with the date and my initials and time on it. And now I'm going to swab the port closest to my patient's IV site. And I would do so for 30 seconds, let dry for 15. And now I'm going to attach the medication. Perfect. And I would be sure to re-swab that for 30 seconds and let dry for 15 before putting this back on. And now you can close the cup. So I'm going to use this table. There we go. And lowering this, I see that the appropriate number is displayed here. Connect it back on here. And now it is again a normal rate, so I'm pushing normal. I see that the light is flashing green, which means that it is charged and it is working. So I would stay with my patient for a couple of minutes and just assess for any signs of hypersensitivity. I would be sure to return once the medication has infused with a 3 ml syringe of normal saline in order to flush the remainder of the tube. I'm also going to sign my MAR that I've given the medication. And before leaving, I am going to do my safety check, make sure the bed's in the lowest position, side rails are up, all bells in reach, and my patient is not in any distress. And again, I will continue monitor for also the effectiveness of the medication and the IV site for any signs of infiltration. Thank you.